Good? Excellent. Good. Kenny Brown, Dennis Stolen. Hi, guys. What we're going to work on today is hip flexor exercises. It's the hip core that we've talked about. This is for anybody that really struggles with their dead bugs, can't get their legs straight, can't keep their spine painted to the floor. These are just some accessory works to strengthen up the front of the hip and get them better aligned so that they can have better dead bugs, therefore transferring down the road. Go ahead and lay back. Like the dead bug, we want them to have their spine painted to the table. He's going to tuck his chin, make it nice and neutral. Excellent. Make sure that their hands aren't grabbing onto the side of the table. Have them folded nicely across their chest. Like hockey walks, we'll see where they carry their stress. When they start doing these, their arms will come up, or they'll make fists, or they'll grab the side of the table. What we're going to look at, we're going to do these bilaterally. So on the first one, both legs are going to be at 90 degrees, good dorsiflexion, 90 degrees at the knee. And we're going to ask him to bring one leg up to 90 degrees at the hip. Come up. Good. Now from this position, what we're going to notice is whether or not they internally or externally rotate their femurs. If they can come straight up off the table by firing the anterior part of their hips. And if they have a good stable position here. From here, we're going to keep the upper leg stable, but we're going to make the lower leg pointing to the ceiling by pushing through his heel to straight. Push straight up. Good. Now Kenny's done these about a few thousand times because he's had 2 hip labral surgeries bilaterally. We're looking for as much top dead center as we can. So they're really using the front of that hip to pull everything upwards. We're also looking that his spine doesn't break contact and that these hips aren't coming up off the table as well, which is going to mean that he's really tight through his hip flexors that are attached to his spine. From this position, we can see whether or not he is going to internally rotate or externally rotate at the femur, or if he has really tight hamstrings and just can't make it there. As they get stronger, as they start recruiting more muscles from the front of their hip, these hamstrings will start to relax and allow him to not only get straight, but to move towards the top. Once they are at their terminal range of motion, he's going to slowly lower this down. A good eccentric lengthening and strengthening of these muscles. As soon as he hits the table, he relaxes right here. Come back up with this one again, please. If they can't get straight, push up. If they can't get straight, what we're going to do, much like our dead bugs, is we're going to have them lower till they do get it extended, and then slowly lower it down. Like our squats, depth will come, height will come on this one. We're going to use transverse abdominis across here to really stabilize their whole pelvic girdle. Come up with this one. Good. Now with this one, he's got a little bit of movement away from midline, so we're going to come straight up, cue him again. Extend into the ceiling, slowly lower it down, and relax. That's 90, 90, and 90 with hip flexion. We're going to do 90, 90, 90 with hip horizontal abduction, really working on using our adductors to lengthen and extend as we open up and not internally and externally rotating at the hip. So we're going to come up with this leg, 90, 90, 90. As he moves away from midline, we're going to focus on him really firing all of his transverse abdominis in the front of his, or the bottom part of his abdominals right through here to maintain this nice neutral hip shelf. Open. Go as far as he can without this hip coming back up, and then he's going to come back towards midline, and he's going to go back to the table. Nice work. Try this one. I'll show you some faults. Come up. Good. Now, a lot of the faults we'll see is people will externally rotate at the femur first, so they'll lead with their knee. People will overcook it and try not to externally rotate at all, and they'll internally rotate and they'll lead with their heel. What we want to do is maintain this nice kneecap to second toe, straight in line, as they open all the way. Come this way. This comes back up, and then down. If they're too tight or they don't have the strength in their abdominals to maintain this good neutral hip shelf, this hip will start to come up off the table. Come up here, open, and then allow this to come up with you. Things will start to come up off the table. You'll have them fire their abdominals, pinch their glutes, keep everything down, come back in, and then slowly lower it down. So now we have this against gravity for the adductors. What we're going to do now is we're going to have him side lying, facing the other way so we can use the horizontal abduction again.